Hello everyone and welcome back to my channel. If you are new here, hi, my name is Haley and I'm so glad you have decided to watch this video. In this video, I will be discussing a bit about two conditions I was recently diagnosed with: superior mesenteric artery syndrome and median arcuate ligament syndrome. Some questions that I will be addressing in this video are things like, what is it? How's it diagnosed? Is there a cure? What's the treatment option look like? Things like that. So let's get into it. MALS stands for median arcuate ligament syndrome. It is a vascular compression syndrome. Normally, the median arcuate ligament rests a few centimeters above the celiac artery. In MALS patients, the diaphragm sits too low, causing the median arcuate ligament to compress the celiac artery. This compression can also press against nerves around the artery as well. SMAS stands for superior mesenteric artery syndrome. This condition is also a vascular compression involving the small intestines. SMAS is when the duodenum is compressed between two arteries, the aorta and the superior mesenteric artery. Compression syndromes in general can have a range of symptoms, all relatively similar. For these conditions specifically, so MALS and SMAS, some common symptoms associated with these conditions are things like bloating, burping and belching, nausea, vomiting, abdominal pain with like exercise, different changes in movement, things like that. For many people who have these conditions, weight loss is also a very common symptom of these conditions. Something that I found rather interesting when talking with my doctor was that MALS can also present with similar symptoms related to one of my conditions called postural orthostatic tachycardia syndrome, or POTS. So things like dizziness, lightheadedness, blood pressure, heart rate issues, fainting, pre-syncopal episodes. Some of those things have been common and related back with MALS. Physical examination can give clues that these conditions are occurring. For MALS specifically, epigastric pain when touched, so like when a doctor will examine your stomach, usually your abdomen will be tender to the touch and it will hurt. And when a doctor is listening to your abdomen with a stethoscope, they may hear a whooshing sound, and that is known as an abdominal bruit, and that is often an indicator that MALS or another compression is present. Both of these compression syndromes are diagnosed in similar ways. Prior to testing for these conditions, it is important to rule out other conditions that can have similar symptoms. The most common diagnostic tests for these conditions include things like a Doppler ultrasound with proper breathing protocols, a CTA with proper breathing protocols, a celiac plexus block, and an upper GI series or small bowel follow-through is also a good test to diagnose these conditions. One thing to note that is very important is when getting these tests done is that you have them done with the proper breathing protocols, along with having them read by a knowledgeable vascular surgeon. These conditions can be easily missed on imaging if the doctor does not know exactly what they are looking for. Okay, so treatment-wise, MALS and SMAS are treated differently depending on the individual circumstances. Let's talk about MALS first. MALS is treated with surgery. Your surgeon will go in and release the celiac artery by cutting the median arcuate ligament. With that, they will include removing any compressed nerves or damaged nerves. There are 3 options for surgery, from my knowledge, for MALS. This is dependent on the surgeon you go to see and the individual patient's circumstances. So these options include open surgery, where they cut from, I think, the sternum down to your belly button. They also have laparoscopic and then a hybrid robotic version. If the compression were to reoccur, there are other interventions that can be done in these circumstances if the surgical release does not work. So I've heard of people getting a stent placed to keep the blood flow open and supplied, and then I've also heard of people using a balloon angioplasty. Both of those are used to keep the blood vessel open if the surgical release of the median arcuate ligament does not work or the compression reoccurs. For SMAS, superior mesenteric artery syndrome. The most common cause of this condition is the loss of the mesenteric fat pad. This fat pad holds the structures in place. If this fat pad were to go away, a compression is more likely to occur. Typically, the cause of this fat pad being lost is due to significant weight loss from either previous surgeries, other conditions, things like that. In the case of the fat pad being lost, weight gain can actually help to restore blood flow. If, however, weight gain is not working or not really an option due to other conditions, surgery is another option for the treatment of SMAS. With that being said, there are 3 surgical procedures that are used to treat SMAS from my knowledge. They are the Strong's procedure, which is where the duodenum is repositioned to the right of the superior mesenteric artery. And then there's a duodenojejunectomy and a gastrojejunectomy, where the jejunum, or the first part of the small intestine, is joined directly to the stomach. Both of these conditions are relatively rare conditions, and because of that, there's very little research about these conditions. While surgery is an option for the treatment of SMAS, these compression syndromes also have the potential to recompress and reoccur. So with that being said, while surgery is an option, it's not always a cure. Around 15 to 34% of the population actually have MALS anatomy, but only around 1% will experience and have symptoms associated with MALS. In SMAS, it has a mortality rate of 33% and is estimated to occur in about 0.013% of the population. So very rare. But with that being said, we are not too rare to care about. These conditions deserve so much more awareness than what they already have. We need a cure. We need better and more effective treatment options. And another thing that I'd like to point out is that just because a condition is rare does not mean that it is impossible. With that, I hope you enjoyed this video. Please like, share, and subscribe if you enjoyed it. And thank you for watching. Bye.